You've been a good boy. Such a good boy you are.
This is a very personal story. It's about a much-loved cat called Mr Skittles, who started life as a stray until vet nurse Liz Puglisi decided to adopt him. Like most kittens, he was cute and fluffy, but he also came with a smorgasbord of health issues, including an abscess, cat flu, and, over time, developed some serious bladder problems, costing Liz and her family plenty, despite working as a vet nurse. Now Mr Skittles has one more hurdle to cross.
Mr Skittles got sent over to us by Jenny and Liz over at Newbridge Animal Centre. Mr Skittles is owned by one of the nurses that works here, Liz, that she also works over there. And he was becoming really lame on his right hind limb a couple of months ago. They took x-rays then, they didn't really see anything. He got much better with anti-arthritic medications. So arthritis is actually pretty common in cats, older cats, but it got much worse in the last couple of weeks. So one of the first things we actually do when a dog or cat is lame in one leg is when we go to x-ray them, we actually x-ray the normal leg as well. So this one is actually an x-ray of Mr Skittles' normal left leg. I just want you to have a look at this area here because it's got normal bone and normal cortex. And this is his sore leg. So if you look here, the bone is more fuzzy. He's got sort of these fuzzy edges to it. And if you follow this cortex down, it doesn't make a line all the way, and there's actually a break in this area here. And that's called a pathologic fracture, and that's what's causing Mr Skittles' pain. So at this point in time, even for pain relief, we would recommend amputation because bone pain is incredibly difficult to control, both in people as well as in animals.
The ARH specialists want to double-check the earlier x-rays against their own to know exactly what it is they'll be doing.
So maybe Mr Skittles' cancer actually started in his lungs and went to his leg. And then his leg is actually the first clinical sign we've seen in him. So that's what we're going to be doing this afternoon. So when Mr Skittles
Now, normally this is a fairly routine procedure, but today it's very personal. The team discussed the options, including euthanasia. It's a tough call for Liz. After all, Mr Skittles is her baby. But it's the best decision. Once the go-ahead is given, Mr Skittles is prepared for his operation, with vet nurse Casey clearing the area to be operated on.
The big trick is not to leave yourself too short for skin. And you're going to make 2 incisions, curving down the thigh. So that's sort of the tibio-tarsal joint, the main joint there, and this is tumour tissue sort of crossing across the joint capsule on either side of it.
The whole procedure, with specialist surgeon Dr David Simpson, takes around an hour and a half. Finally, Mr Skittles is slowly brought out of his anaesthetic. Loaded up with pain relief, he's totally unaware of what's happened to him. He'll recover over the next 24 hours with plenty of TLC from all of the vet nurses at ARH. And amazingly, within just a few days, Mr Skittles can go back home. In a week, he's moving around almost as if nothing has happened. The best part, of course, this time he's in no pain whatsoever and learning to walk a different walk. But the biggest reason for telling you the Mr Skittles story is that for animals, an amputation of a limb can not only save their lives, relieve their pain, but they cope so much better than we humans do. As you can see, Mr Skittles is doing just fine.